understand clearly, this question is concerning the Prime Minister of Canada's notion of deterrent fees associated with visits to healthcare professionals and how this could impact the healthcare system. I understand why the Canadian government would want to implement this new policy, simply due to the long wait times and the cost to run the current universal healthcare system. There are many advantages to this plan that should be taken into consideration. Firstly, as mentioned, it could deter people from visiting their healthcare professionals for unnecessary reasons and resulting in more available appointments with healthcare professionals for legitimate medical concerns. This is an advantage for both healthcare professionals and patients because wait times would be shorter for patients and the workload for healthcare professionals wouldn't be as heavy. Secondly, another advantage to this policy would be through basic patient-practitioner interaction. Due to the deterrent fee, patients would be perhaps take their health more seriously as well as their well-being. They can make a more conscious effort with regards to their health and become more educated on their well-being. Not only would patients be more conscious of their health, medical professionals may hold higher standards for themselves due to the fact that their patients are paying for their service. With that being said, appointments with healthcare professionals would be much more efficient as they would be likely to be there for a more serious health concern. Finally, this policy also would be a way for Canadian government to make more money. Taking into consideration the amount of appointments booked within any given day with healthcare professionals, this would be a substantial profit for the government. It could lighten the government spending on healthcare, freeing up funds for other programs and new technologies. On the other hand, there are also several disadvantages associated with the plan. First of all, individuals are already hesitant to visit the healthcare professionals, and adding a deterrent fee to their visit could be detrimental. If an individual is truly ill and they don't see a healthcare professional in order to save money, their illness can increase severely. This would limit the possibilities of early diagnosis and it would also not support or encourage preventive care. This can lead to more serious consequences for the person, such as death, as well as the spread of the illness to others. There's more of a financial burden on the government to care for a serious illness that could have been treated for an early visit, with an early visit to their healthcare professional. For example, the United States private healthcare system runs on this premise of the heavy fees associated with medical treatments, with results in extreme cases and more expensive treatments. A second disadvantage would be the fact that this very notion goes against the principle of universal health care. This policy would discriminate those in a lower income bracket compared to those who have a higher income and can afford this type of fee without thinking twice about it. With that being said, another disadvantage that this policy would only have an effect on those who cannot afford a $10 fee with each visit to their healthcare professional. And a third and final disadvantage to this policy is that the benefits mentioned earlier are only short-term. The financial gains from the fee would provide some funds for the government, and fewer individuals would book appointments to meet with their healthcare professionals because of the fee, but this works in short term. But in long term, it actually becomes more harmful to society. The long-term effects would involve more serious illnesses to be cared for, which are more expensive on the healthcare system and would result in more time needed from the doctors to care for patients. In conclusion, this policy has more disadvantages than advantages. Even though there are more obvious immediate benefits, this policy is discriminatory and can result in not only serious illnesses but also death. Therefore, I question its efficiency, and I believe that there are more effective solutions to this issue. An example of a solution would be to implement a policy only for frequent visitors and not the general public. An example would be to impose a $10 fee after an appointment is deemed unnecessary by a healthcare professional. This would apply to those who visit the doctor's office more than a predetermined amount of visits over a predetermined amount of time. Thank you.